Lewistown Hospital or the Western Region for Geisinger had never had a residency program before. The reason that this was so important is that there's a huge shortage of primary care doctors all across the country, but that shortage is especially pronounced in rural regions. And so Geisinger and Family Practice Center joined forces to help to create a residency program that would meet that need in our own community.
So for our residents, once they graduate, we want them to be competent enough to practice in this world, and things that they're exposed to during their residency is what they carry throughout their life. And when we are training our future docs, future family docs, we want them to be as competent as possible.
This program was created by doctors who spent their careers practicing in rural and underserved areas. Being able to build a program from the ground up, we were very mindful about what skill set do our residents need. We were able to really create a residency program where we can train our residents with an expanded scope of practice. We can offer electives in different areas within Family Practice Center or Geisinger so that they can build a skill set maybe to their particular interest. And we have the resources of both Family Practice Center and Geisinger to be able to do that. It's a really unique educational environment.
I do see that the value of and the training that we have here in the underserved areas is far better than some of the training that we might get in inner city hospitals. And I know in the past 5 years we have seen significant growth in the amount of like the curriculum or the structure we have in the program that I think competes with some of the best in the country.
The residents are the heart of any program, and our residents have trained from all over the world. They have different skill sets. Some of our residents actually had entire careers before they trained in medicine.
I love the creativity involved in being able to plan new programs and develop new programs or morph programs to like the changing healthcare climate. I like being able to think bigger and think outside the box and be creative. We're updating and adjusting what we're teaching residents so that they're on pace and up to date with what's expected of them when they graduate residency. We also are constantly seeking feedback from the residents about what they want to see in their trainings. It's all of those things together.
This program is a 3-year family medicine residency program. It has a curriculum that sort of guides us through each year with the different rotations that we do. And in all, just preparing us to be amazing physicians when we're done in 3 years.
Being a resident obviously means putting the hours in, working here in the hospital, working in the clinic, working with a whole range of staff. And we see patients in the clinic about twice a week, and we really get to follow them throughout our 3 years. So we become their doctors.
Training a rural program as a family physician, I believe, is very essential because what we do is not one thing, we do everything. So for you to be well equipped to be a generalist in that sense, you need exposure to everything, which is what training a rural program gives you access to. So you see all these things and then it prepares you that, okay, so when I have my own clinic, if something like this comes in, I should be able to take care of that because I have seen this before, right? So training a rural program gives you that very wide exposure, like varied exposure to so many things that you'll be confident to be a true generalist in the sense.
We have the opportunity for robust inpatient hospital teaching, outpatient family medicine, and outpatient clinics and other subspecialties for that matter, and then didactics where we have our dedicated time for lectures and learning. I think the rural setting of this program has allowed me to become a better physician because we have the opportunity to really interact with patients on a level that you don't get everywhere.
Our goal is to make sure that they feel ready and empowered to be the best clinicians that they can be, both from how they are walking into the room and working with patients and their knowledge base and skills base. So we try to make sure that they have the well-being skills to take care of themselves, as well as the behavioral health skills to communicate effectively with patients and their families.
Yeah, so just a great rural family medicine residency where we're learning a lot.
I think when you train in an underserved region, you develop a skill set that allows you to go pretty much anywhere and practice medicine. You learn to be very resourceful, you learn to work within a multidisciplinary team, we really love that. We don't know what challenge every day is going to bring. Sometimes the residents, they don't know that they have a certain passion until they come and train in this area. It might really spark something for them and open up, career opportunities for the future.
The lifestyle here is, pretty laid back. It's really beautiful. You get to see 4, seasons, and every season is equally beautiful. And that's something that I really, admire about this place.
So when you're in the bigger cities, they do not bring a lot of things to you because they rather go to more specialists or specialized hospitals. But here we see everything, and then you just get exposure to so many procedures. You're able to do this even in the office. We take out lesions, we do skin biopsies. In the bigger cities, they'll send those to like dermatologists or more specialists. But here we get to do all this fun stuff. It's a one-stop shop for everything, so I could see everything I wanted to see here. And again, it's just very homely, because I could just walk into Walmart and then I see the patients I saw. It's like, oh, is that Dr. Dundu? I saw you at the hospital, So these are the perks of serving in a rural community.
We have a lot of opportunities to kind of explore outside of work, whether it be if you want to go to one of the many state parks around. There's semi-major cities in the area, being State College and Harrisburg, and if like a bigger city is kind of what you're interested in, Pittsburgh, Philadelphia, Baltimore, New York are all within a short few hours drive. I also think that being in rural central Pennsylvania in a program that really prioritizes wellness is of great benefit, especially that's one of the huge drivers for me coming here, is that I knew that wellness being a priority, I would have time to enjoy the beauties of central Pennsylvania and the rural atmosphere. So it's not just something that we know the state parks exist, we actually have time to go visit them. Whatever opportunity you seek here, you have the time to actually pursue that.
I actually love living here. I find that it's a fun combination. Although we are a rural family medicine residency, the benefit of that being we get to work in a small community, everyone kind of knows everyone, but also being this close to State College, you have almost every ethnic restaurant available. You have big stores like Costco, Aldi's, Target, things like that available to you as well. We have local international airports in Harrisburg to go on trips with. And so I feel like even though this might seem like a rural location, and it very much is, you can also get a lot of the amenities of living in more of a bigger town. And for me, I find that to be great.
Favorite part of being in this residency is definitely the people. I'm starting to create relationship with patients. I look forward to seeing them, seeing how they're doing. So yeah, that's probably my favorite part. It's just the people.
As far as being a resident in this program, I think that it's obvious to see that they've prioritized both the academic side of medicine and the well-being side of medicine.
My favorite part about the residency program is the people. I love the people again. I cannot overemphasize how supportive the people are, very welcoming, very friendly. It's just like kind of person I am, because I'm all about, okay, what are we doing, bubbly, and everyone here is like that too, so it's very easy to fit in. It was very easy for me to fit in, so yeah, the people are my favorite part of this residency.
My favorite part of the residency program is the support that I get from the attendings. In this residency, you're supported the whole way through as much as you'd like.
So I often say that our residency is the best of both worlds. And what I mean by that is that our residency is housed within Geisinger's Western region. Geisinger-Lewistown Hospital is where a lot of the rotations occur. And our residents are unopposed. We're the only residency program within the Geisinger Western region. So they don't have to compete with other residents. They are the resident. When people say the residents in the hospital, they're talking about our program.
I really love working with the system that I am in right now, and I've been part of the residency program for the past 5 years as well, and this is something that really keeps me going.
The residents come here and they become part of our family, and that doesn't end when they leave here. Being able to be part of such a supportive environment, to learn from our residents, to be challenged by them, is just a really amazing opportunity. It's what I love most. And so from the start of this residency program till, we're 5 years in, it makes me very proud that we can serve our community this way.